Hi everyone, my name is Dr. Asa McGraw. I'm a holistic fitness coach as well as ortho pelvic floor physical therapist. In this video, we're going to be talking about something good. Well, it's good, but it might not be good if you clicked on this video. We're going to be talking about what to do if you are experiencing painful sex, because sex should not be painful. It should be pleasurable. But the good news is there is so much that you could do about it, and we're going to get into all of that in this video. Now, do you feel like whenever you're about to put anything into your vagina, penis, toy, finger, maybe even tampon, everything like tightens up and it hurts? Like it feels like nothing really wants to go in there. Or if it does get in there, it does not feel comfortable. Or with deeper penetration or these deeper thrusting type motions, it kind of hurts. We are going to talk about what to do if either of those situations hurt. Maybe one, maybe both, maybe experience some pelvic pain outside of sex. But we are going to talk about what to do to kind of help some of these muscles in there start to feel a little bit better. Now, if you've had long-standing issues with pain with sex, any potential issues in this pelvic region, definitely go get it checked out by a doctor. But one of your best things that you can do if you're experiencing pain with sex, pain in this region, is go to see a pelvic floor physical therapist. I am a pelvic floor physical therapist. I treat conditions like this, and I'll show you some of the things that I prescribe as a physical therapist to my patients that are experiencing pain with sex. Now, whenever you go to put anything into the vagina, these muscles, they need to relax. They need to lengthen. Everything starts to fill with blood as you start to get aroused. If you aren't getting aroused, maybe that could be due to stress. Maybe that could be due to you have a whole bunch of different things going on, so you're just a little preoccupied. Maybe it's due to a strain with your partner. But that arousal, it's going to be that first step in allowing some of these areas to fill with blood and relax and lengthen. Now, if you are aroused, that should start to happen if you are getting ready to get to it. There are so many other psychological factors that are at play with this, but getting that arousal is important first. These muscles, they need to be able to lengthen and relax and fill with blood to allow for insertion. If these muscles are super tight and they don't want to let go, they are not going to let anything in there. And because they're so tight and they don't want to let go, putting anything into this vaginal canal, it is going to hurt. So, like I said, it could be due to stress. It could be due to like strain in the relationship. It could be due to all different things going on in your life. But a lot of the times, allowing your nervous system to kind of calm down, get into this relaxing state, is a good way to allow some of these muscles to relax and lengthen. So maybe you are getting aroused, but you're like, okay, why is this still not working for me? These muscles, they need to be able to relax and lengthen. And by lengthening these muscles and tapping into this parasympathetic nervous system, you're allowing those muscles to relax and let go. I will show you a couple of those in a second. Now, if you have pain with this deeper penetration, it could be some of these muscles on the deeper portion of your pelvic floor or pelvic wall. So like I said, a lot of us are so amped up from all the things that we're doing in our life. Maybe you're working out, maybe you got kids at home, maybe you are working, maybe you're doing all of these different things. Our pelvic floor feels it and it holds this tension. And when anything goes to hit it, like a penis, it could hurt. So one of the best things that you are able to do, just like I was talking about before, there are specific exercises that I use to kind of relax some of these outer layer muscles, but getting these inner layer muscles to relax is going to be very important as well. So your pelvic floor, I didn't say this, so I should say this now. Your pelvic floor is a sling of muscles that rest at the base of your pelvis. So there's muscles on the inside, like you could see right here, and then there's muscles on the outside. There are specific exercises, which we're going to go over in a second, that we're able to do to allow these muscles to relax and lengthen. And once these muscles are able to relax and lengthen, it could allow for sex that is less painful. Now, there are other conditions such as endometriosis, PCOS, that might make sex painful due to just having like this underlying condition. This is why I said it is good to go get this checked out by your doctor just to make sure that there's not anything else going on. But this can also be addressed with lifestyle changes. Things like modifying your diet, modifying your stress levels, modifying your exercises, because all of these things will highly influence all of your systems in your body, influence your hormones, and can actually help you resolve a lot of the symptoms that you're experiencing. So I really talk about the movement component, which is what we're going to get into next. I'm not trying to delay it, but I just want you to understand there's so much at play when we're dealing with any of these particular conditions, because this is your body telling you that there's something off. These exercises that I'm going to show you, they're going to be here to kind of help things along. So this is something that you're able to do maybe before sex to kind of let these muscles let go so you have a bit of time, or after sex, maybe as kind of like a little cool down after your activity. But we need to address why these things are happening in the first place. And a lot of the times why these things are happening in the first place is due to our diet, our lifestyle, how stressful our lifestyle is, working all day, sitting all the time, the people that we're around, the foods that we eat. All of these things are at play when we're dealing with these pelvic floor conditions, pain with sex, but so many other conditions. Because if you're experiencing this, I bet you're experiencing issues in other areas as well. I bet maybe your neck hurts, maybe your back hurts, maybe you have IBS, maybe you have pain in various other regions in your body. Maybe you have other conditions that are going on, but you really don't understand why this is happening in the first place. So I brought you here talking about pain with sex, but this is just a warning sign that your body is giving you that some other things are off. This is just where you happen to be getting the symptoms. So now let's go through these exercises. I'm done talking. I won't give you anything else. So let's just get through these exercises so you can go back to enjoying sex. You know what it means when you put your hair up. Time for exercise. So right here, what we're going to be doing is kind of stretching out some of these muscles right through here, and then some of these muscles on the inner portion of our thigh. What we're going to do is we're going to bring our legs nice and wide. All we're going to do is reach our arms forward. Now, what you're going to do is you're going to breathe in through your nose. And when you breathe in, you're going to feel what is called this 360 expansion. So you're going to feel air move into your chest, sides of your rib cage, your back, your belly, and lengthening through your pelvic floor in this inner thigh region. This is allowing your breath to tell your body it's okay, that these muscles are able to let go. And I really want you to focus on lengthening or letting go in that pelvic floor area. So next is going to be a posterior capsule stretch. What do I mean by that? So pretty much what we're going to be doing with this one is we're going to be stretching out this back door area, kind of like your butthole region. So we're going to be stretching out this area. And one, this could be a big portion of those muscles that you're hitting with this deeper penetration. But two, a lot of important nerve structures run through this area that go to innervate these muscles on the outer portion of our pelvic floor. So allowing this area to move a little bit better can actually help with that pain with insertion. So you're going to get onto your hands and knees. This looks familiar, right? All you're going to do is you're going to take one leg, cross it over your other leg. There's going to be a little bit of an arch through your back. And you want your hip to be directly over this knee. And you're just going to breathe into this back door area. So you're breathing into your butthole. Okay, full breath in. Exhale. Breathe in. Relax your booty. Exhale. All right, and then next we have an adductor rock back with a trunk rotation. So I said in the beginning, this is multifactorial. And I talked about kind of like the pelvic region. And yes, the pelvic region is huge in this, but this upper body is extremely important as well. And this exercise is going to give you that lengthening and relaxing of your pelvic region, but also get these other areas above your pelvic region moving a little bit better, because this highly influences this as well. So all you're gonna do, hands and knees, stick one leg out to the side. I'm giving you ideas. All right, and what you're gonna do is you're gonna take one arm, reach around, take a breath in, send it back, take a breath. Reach one arm, send it back. So next is going to be a hamstring stretch to a hip flexor stretch. Like I said, a lot of these muscles that are in your hips, close to your pelvic region, are going to have a big influence on like your actual pelvic floor and the symptoms that you're experiencing. So allowing some of these other muscles to move a little bit better will be very important. These hip flexor muscles usually are a big part in this. So allowing them to start to move a little bit better is going to be really important. So we're getting to this half kneeling position. All we're going to do is we're going to bring our hips forward. So little push forward through our hips. Make sure you're not overarching through your back. Little push forward through your hips. Take a breath in. Good. Now shift your hips back. You'll feel a stretch through the back of your hamstrings. Take a breath. Hip flexor. Hamstring. All right, so hopefully you feel a little bit stretched out. I want you to try these before activity, maybe after activity if you notice it's a little bit more painful even afterwards. Even on the days that you're not doing this, just give your body more of this so that your body starts to remember this. You might even find you might be even a little bit better at different positions just because you have more mobility in this region. So hopefully you enjoyed this video. So please subscribe to my channel. I talk about all things in relation to the body, not just sex. This just happened to be a fun one that we did just because this is a topic that we don't necessarily talk about the pain with sex because this is not something that we typically enjoy. But if this is you, this does happen to people. You are not the only one, but there's so much that you can do about it. Like I said, any questions, let me know. Comment below. What questions do you have for me? What do you want to see more of? And if you're interested in learning about the pelvic floor anymore, I have a free training that I link below. And I will see you guys next time. Bye.